Welcome to Not Milk Never Milk. Subscribe if you're lactose intolerant.
You start by preparing quickly. Check the bottle for expiration and damage because integrity affects dose. Once confirmed, wash your hands and gently clear each nostril with a soft blow. This helps delivery. Make sure the nozzle is clean, remove the cap, and shake if the label says so. Now prime with 1 or 2 test sprays away from your face to ensure a consistent mist. This is essential so your first therapeutic spray actually contains medication. You continue by positioning for accurate delivery. Tilt your head slightly forward and hold the bottle upright so the spray disperses correctly. Insert the tip just inside the nostril, aiming toward the outer wall, not the center septum, because that reduces irritation. Close the opposite nostril with a finger, breathe in gently, and activate the pump while inhaling. Count 1 to 2 seconds to pull the mist into the nasal passages. Repeat for the other side if you finish by wiping the nozzle with a clean tissue, replacing the cap, and storing the bottle upright at room temperature. This preserves the spray and prevents leaks. Make sure you track doses and adhere to the label frequency so you don't overuse it, which can worsen symptoms. If you notice weak spray or no mist, reprime with a few test pumps as directed or check for blockages. If stinging or heavy bleeding occurs, stop and consult a healthcare professional immediately.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.